All right, I am talking with Scott tonight, and Scott, you experienced use of smokeless tobacco for how long?
33 years.
33 years. And you tried to stop doing it before.
Yes.
And why don't you just tell a little bit about what you experienced in the past, and your general take on your use and your experience with it. How it's gone for those 33 years.
Well, I started it, of course, at 13, and all my friends were doing it, and there was nobody to say it was bad. And that's typically when, I guess that was the starting of when women were told not to smoke while they were pregnant. And I remember my mother actually smoking when she was pregnant when I was in her belly. But anyway, all the peer pressure and where I grew up, and it wasn't bad for you, and you were a man if you dipped it, and it got to be. It went from a 1 can a week to 3 cans a week, and then it finally progressed to 4 cans a day, where I was spending about $80 a week on it. And the first time I tried to quit, I went to a regular medical doctor, and he put me on patches. This is when they were prescribed. Put me on patches, and I chewed sunflower seeds. And the problem with the patches and all that, they don't give you enough tools. The patch is just a patch. There's nothing to fix the oral fixation that you have with something in your mouth and rolling it with your tongue and chewing on it. And so I lost that, and I actually tore my mouth up worse because I chewed 10 packets of sunflower seeds a day. And then the second time I tried to quit, I used chantix, which was through another doctor, and I made it. The first week you take it, you can dip or smoke or whatever you want to that entire week for the 7 days, as much as you want. And at the end of that 7th day, you start a new set of pills, and the pill works on your mind. It's supposed to block that, I guess, the yearning for it, but it never really blocked that oral sensation or the oral fixation that I had. And my wife and I had talked about hypnotists, and we were living in Mississippi, and there were no hypnotists there, and I didn't want to go to one of those fly-by-night hypnotists that show up at a convention center and you pay $45 and he makes fun of you, and then supposedly you stop dipping or smoking. And we moved here, and the subject came up again one day when I was just at wit's end, basically. Just all I would do was dip snuff. I'd wake up, and the first thing I would do is get a pinch of snuff, and then I would take a shower and spit it out in the shower. I would get out and get dressed, brush my teeth, kiss my wife goodbye, and put another dip in on the way to work. I got to work, spit it out, and started looking at what I had to do for the day, and would get another dip. By the time it was 6:15, I had already dipped 1 can, and that I'd been up since 4. And then throughout the day, I would constantly spit one out and put one in, spit one out, put one in, and it just.
So you do how many cans a day?
4 cans a day.
4 cans a day.
Yeah.
Okay.
And then my wife I talked to her one day, and I said, "It's just I can't stop, and I have to stop." And my son was kind of getting on to me. He says all I did was dip, and it makes you feel bad after a while, And I didn't get the sensation anymore of, that dip where it give you a little high. I didn't get that anymore. And so my wife found Dr. LeBLEU on the internet, and I called you one day and talked to you, and I'm a pretty good judge of voice, the character behind the voice, and so I wanted to come meet you, and we did. I brought my son, and my son liked you, and I knew in my heart you were going to be able to help me. And then we started. You introduced me to LeBLEU, and you gave me several tools which I was never given by a medical doctor to help me with that oral fixation and to keep me from thinking about it. Or
That really made a difference, didn't
the
it?
LeBLEU and the dental sticks. I went with dental sticks, and the gum with a kick, like Dentine Ice, and the Mentos chewing gum, and
It's gave you something to fight it with.
right. But I never did anything to where I would keep it like a piece of candy in my mouth.
Yeah.
Because I didn't want it sitting in one spot to remind me of that.
And you turned out to be a good and responsive to hypnosis.
Right. Oh, the hypnosis works. I mean, 100%. Because without that and the tools, I wouldn't have made it.
Yeah.
But all in all, the hypnosis is what that reassurance and that I just don't know how to explain it, but the better of it is the hypnosis, and then the tools help me. But most of all, I listen to the recordings in the morning before I leave for work. I'll listen to it when I get home tonight. After we have our session, I'll go home and take a shower, and I'll relax in my chair and listen to another one. And,
So you'd agree it's a combined approach that gets you,
right.
that's
But-
gotten you. And you now are on your 9th session, and you're at a point where you no longer do it, you no longer want it, you no longer think of
I
it.
don't think about it, anything.
You're over with it.
I'm done with it.
You're
I'll
done
never,
with it.
I'll never do it again.
You'll never do it again.
And I have not had the first withdrawal. I've not had a headache. I have not had a stomach ache. I know people talk about headaches and coughing and stomach aches, and I haven't had any of that. The LeBLEU's really helped me. I think listening to my recordings of the hypnosis and just
It's all come together.
everything.
And
everything.
you
And I feel so relaxed when you're hypnotizing me when we're going through our session. Whenever I don't think I've ever been that relaxed, and I think that has helped my mind ease away from the yearning. And when I tell you I had a yearning for it, it was I can remember if it was a stressful day or something was going on. If I woke up in the middle of the night, I went and got a dip instead of sleep.
It was that strong.
That strong.
I see. Okay.
And it doesn't. And it, the thing about it is, I'd been through some low points, and my wife and I had talked about this when I was a policeman. You don't get paid very much money. You just don't. But it was almost like a drug because I had to have that snuff, and it came to a point where, well, do I go buy, this, or I can go buy 2 cans of snuff,
Yeah. Yeah.
But I'm done with it. I don't want it anymore.
Fantastic.
And like now, I don't even, like I chewed, I think, 2 pieces of gum today. So I don't have to have anything in my mouth now.
Great.
So,
Great.
And I don't have that's another thing, Doctor, but I don't have the cravings. Because a lot of people that quit dipping and quit smoking have craving, and I haven't had that.
Mm-hmm.
So.
Fantastic.
Yeah.
So overall, you'd recommend this approach for somebody who has a problem with smoking, with smokeless tobacco, and you'd say that they should expect good results.
Go with a positive attitude. And
yeah.
With your help, and 100%.
It works.
It works. It works.
Great. Fantastic. Well, what's the last thing you would recommend to somebody that's trying to make their mind up whether to try this program out or not?
You just need to try it. I mean, you have to stop doing this.
Have faith, believe in it, give it a shot, and it'll work.
Positive mindset, and be on point. Have a support structure behind you, which is your family or a friend, and just go for it. I mean, you have nothing to lose. Well, you do if you keep dipping or smoking, you're going to die.
That's right.
And I wanted to spend time with my son and my wife, and I want to live. So
that's right. That's right. Well, you've stuck to your program, and as a result, you are enjoying reaping the rewards and the benefits and the advantages. You've stopped dipping, stopped chewing, and you've eliminated your risk, your healthcare risk in that regard, and that is big. That is awesome. You've changed your life materially for the better, and you're not going to go back on it, are you?
No, I'm not.
You've quit for good.
That's right.
Fantastic. Well, I wish you the best of luck, and thank you for this interview. Maybe it'll help someone who's trying to decide whether it'll work for them.
I hope so.
Thank you.